Hello, welcome back to Mirror Interpretations Todorova YouTube channel. My name is Ioana and I am an interpreter, guys. Thank you for following, liking, and subscribing. Even though I haven't had any subscriber in quite some time, I know the quality of my videos has been bad because of the light, but I'm trying to fix it. Thank you for your patience. Despite that, I'm trying to deliver you the most useful information to be the best interpreters ever. Okay, guys, I am creating this video number 7 about heart-related problems. Okay, we did 1, 2, 3, 4, 5, 6, and this is 7. We are going to talk about tests that we do related to cardiovascular systems. Again, guys, this kind of test we're gonna use and we're gonna interpret for on a daily basis as medical interpreters. And the first one is the blood test. The blood test is when we draw the blood with a needle, normally from the armpit of the person, and we check the body conditions. So when we drain the blood, there is few things that we could see. The first and the most classical thing is the blood count, the type of the cells, white red blood cells, if there is equilibrium and balance. If there is no equilibrium and balance, we talk about the disease, we talk about the cholesterol, the blood pressure, and so on. You could check on those links above and see that videos about blood related problems. Okay, another thing is called Prothrombin Time. Forgive me if I don't pronounce it well, but when they do the blood test, it's very easily to see the Prothrombin time, or this is the time for which the blood clot. Because the people that suffer, for example, diabetes, I'm so sorry for the accent again, they have a longer Prothrombin time, which means that their blood doesn't clot as fast as normal people, or some people does not clot at all. All right, so the third thing is called basic metabolic panel. So when we do the blood test, there is so many organs and their functions that can be controlled. They measure the glucose, the calcium, nitrogen, creatinine, blood sugar level, kidney function, liver function, and so on and so on. There is another very, very specific blood test, let's say blood test for STDs. So the classical blood test can give you these details more or less, and then sometimes the doctor make a specific blood test like an STD test, or there is maybe gonorrhea or hepatitis B or something like that. There is a specific blood test for that. But in the classical blood test, we could see more or less that one. Also, guys, in the normal blood test, it's very easy to see if the person have a severe infection, because if the person have a severe infection, normally go to the blood and change the blood consistency and discount on the blood test. So this is what you need to know about the blood test. The second procedure related to cardiovascular system is a blood transfusion. We all know what blood transfusion is, when the blood gets injected into the body. Normally, when people receive blood, is for life-saving procedures. And you need to know in the target language what is blood transfusion, because normally before people do any kind of testings or any kind of surgeries and whatsoever, even a delivery of the baby, there is a questionnaire for permission for blood transfusion. There is some people that doesn't receive blood for religious purposes and they don't want to be saved no matter what, they don't want to receive blood. But you always have to pass through the questionnaire. Are you allowing blood transfusion in case necessary to save your life or whatever? The questions are normally more or less like that. So Of course, to know here, the blood is tested before transfusion, and also the blood types get tested in order to match. Okay, number 3, it's bone marrow transplant. This is something that I personally encounter very often in my interpreter work. So you guys have to know what is bone marrow transplant. Before we even start, the bone marrow is related into the spine cavity, and there is the place where the red and the blood cells get produced. So when there is disequilibrium or some kind of dysfunction or problem on the bone marrow, this special, in Bulgarian is called kosten mozak, in English is called bone marrow. When there is problems there, normally people suffer from leukemia, not always, but leukemia is one classical sample. Actually, my best friend used to suffer from leukemia when I was 16, and I discovered a lot about bone marrow chemotherapy and so on. So I know in detail, but I'm gonna cut it short for you. So when people have leukemia, for example, they don't produce good quality or as well quality or so on of red and blood cells. There could be a lot of red or a lot of blood or white blood cells, or there could be red blood cells that they eat white blood cells. There could be some kind of abnormality that happens there in the bone marrow. We talk about the blood problems. You can check this video somewhere there about this disease that are related to it. I just slightly talk about it. So what happens when people have leukemia or they have a problem with the bone marrow, the first step is chemotherapy, radiant or chemotherapy, radiation, some kind of a radiation. What this radiation do? It kill the patient's own bone marrow, and then in the same cavity on the spine, in the same space, become injected the donor's bone marrow. This is a very complicated procedure, and normally it's very difficult to find the proper donor. In fact, my friend was adopted, and it was so difficult because for a guys, only the female from the family side of the mother can be a donor. So it's very, very challenging to find a proper donor when you need bone marrow. So this procedure is really complicated. Also, during the radiation, people, it's like having a chemotherapy. They lose their hair, they become blue, and it's really, really fighting for life periods. My friend had about 3 years like that, and I remember he would come see me when they released him from the hospital. He would not have hair, or he would be all blue, and he would just talk about people that fight for life every day. So I am saying this, guys, because I want you, when interpret, remember that sometimes your patients are dying. They're in pain, they're suffering, they're confused. Be compassionate, be patient, try to do your best, because your words may be the last word somebody hears. Try to be as kind, as polite as possible, guys. So that was about the bone marrow transplant. Sometimes there could be serious complication, a refusal to accept the bone marrow, and so on and so on. But I'm just gonna cut it there. You just know what is bone marrow. I will give you a few most common tests related to cardiovascular system. The first is echocardiogram. This is a cardiogram that sound waves are used to see how the heart works. Structure in the movement of the heart are seen through the echocardiogram. The second one is electrocardiogram. This is when we see the electrical system of the heart, or this is when we talk about, here I have this painting. When we talk about this node, adenine nodes that send this impulse to the heart, when there is some kind of a sense problem or a nerve problem, these kind of problems we could see thanks to the electrocardiogram. This shows us the heart beating and the electrical nerve system of the heart. And the test number 3 that you guys gonna encounter every day in your interpreting life, this is the stress test. In the past they call it exercise tolerant test or ATT. Now they call it a stress test. And everybody know when we talk about stress test is the test of the heart. I did myself this kind of a stress test not long ago. So on this kind of test, you guys get patches on your chest, on your body, a special cables that can monitor your heart work. And you also have a second technician who is measuring your blood pressure on the right side. You start to walk on a treadmill, and every 3 minutes they augment the speed and the difficulty of this incline walk, and they basically observe how your heart works in a time of activity or heart activity or so on. A stress test could take between 15, 20 to 1 hour, depending how good shape you are and how well exercised you are. You could see the blood pressure, how the heart work, the muscles of the heart, and so on and so on during the exercise. This is a classical stress test, and there is another stress test, few different types, one with a contrast and another one with a radiant, that you eventually can encounter interpreting. But normally what is happening, the doctors give the instructions before the test, and then the patient just run or walk the treadmills. Sometimes you stay on the line, but very, very often you give the instruction and they disconnect with you. Okay guys, that was everything for mirror interpretation Todorovas. You had a few common procedures and tests related to cardiovascular system. Thank you for being here. Merry Christmas to everyone, and Happy New Year's. I hope you enjoyed that video. Please like, subscribe, and share. I need you guys. I want to get 1,000 subscribers. So please, if you like this video, if you find it useful, if it helped you, if you learned something, press like. If you didn't like it, press dislike. If you want to see a video or topic that I talk about it, please write a comment below. Again, that was everything from Ioana, Mirror Interpretation Todorova. Have a wonderful Sunday from snowing Denver, Colorado. Thank you and bye-bye.